What are the kidneys and what do they do? Most individuals have two kidneys which are on each side of your lower back. They are an important filter in your body. The kidneys make urine which travels down your ureter, then into your bladder. Why is a nephrostomy tube placed? When a kidney is blocked, urine is unable to drain into the bladder. A blockage could be caused by stones in the kidney or ureter that don't allow the urine to pass, or strictures or narrowing of the ureter. How does a nephrostomy tube work? A tube is placed in your kidney that will exit through your back. At the end of this tube, there will be an attachment to connect to either a leg bag for daytime use or a larger bag for nighttime use. Along with the external tube, there may be a little lever called a stopcock, which when turned will either stop or allow the flow of urine. When the bags are 2/3 full, it is time to drain the urine into a container or into the toilet. You may be asked to measure the amount of urine prior to disposing of it. Caring for your nephrostomy tube. To care for your nephrostomy tube, this will include daily inspection of the dressing and securement device along with dressing changes every 7 days unless the dressing becomes wet or loose. Leg or overnight drainage bag cleaning and attachment. Flushing the tube if your doctor prescribes. Monitoring the exit site, amount and color of urine. Contacting your doctor when concerns arise. Dressing and securement device change. Supplies will need to be purchased for routine care of your tube and site. These can be purchased through a pharmacy and/or special order. A list of supplies and ordering information will be given to you upon discharge. To make it easier for you to take care of your drainage catheter at home, it has been secured to your body with StayFix, a catheter fastener. It was designed to be comfortable on your skin while it sticks securely and keeps your catheter from moving around. It also allows your catheter to lay flat against your body and helps prevent the catheter from kinking. Inspect the StayFix fastener daily to make sure that it is still holding the catheter securely and continues to stick to your skin. Each fastener will remain on your skin for up to 7 days. After that period, the fastener will need to be replaced. The date of your first dressing change will be written down for you. If you notice the fastener coming loose sooner, have it replaced with a new StayFix. Clean the skin around the nephrostomy tube with soapy water after replacing the StayFix device every 7 days. After cleaning the skin and letting it air dry, apply a new StayFix. Instructions for applying a new StayFix. First, gather the supplies needed. StayFix fixation device, a transparent dressing, 4x4 gauze pads, cotton balls and cotton swabs, surgical tape, and gloves. First, thoroughly wash your hands with soap and water. Keep in mind, a stitch is used to hold the tube in place. Carefully remove the dressing with liquid soap and water if needed. Dispose of that dressing and the gloves. Wash your hands again and put on clean gloves. Using a Q-tip, clean the skin around the tube site with liquid soap and water. Using a cotton ball, rinse the area well and let it air dry. Apply the new StayFix device. Instructions are included in the discharge information. Cover the StayFix with a 4x4 gauze pad and then the transparent dressing. Wrap the tubing connection with gauze to protect the skin and secure the gauze with paper tape. Look at the nephrostomy tube as you sit and stand to check for kinks in the tube. If there are kinks or you are seeing no urine flow, reposition the tube. When finished, wash your hands. Drainage bags. Leg bags are secured to your leg with straps for daytime use. These will fit under or over loose pant legs. A larger bag will be used for nighttime use to allow for greater urine collection to allow for sleep. When switching drainage bags, it is important to use an alcohol swab or wipe to cleanse the end of the connector prior to reconnecting. Clean each bag after use with equal parts vinegar and water solution. Rinse and allow to air dry. Every 7 days, drainage bags will be discarded and swapped with a new bag. You may be asked to record the amount of urine removed from each bag prior to disposing of it. It is important to keep each drainage bag below the level of the kidneys to prevent urine from backing up into your kidneys and potentially causing an infection. Switching out your drainage bag. Empty the drainage bag during the day whenever it is 2/3 full to prevent urine from flowing back into the kidney. During naps or sleeping at night, a larger drainage bag should be used. Keeping urine bags lower than your kidney prevents backflow into your kidney. Each morning upon waking and every evening at bedtime, you will need to change out your bag. First, gather your equipment. You'll need a clean drainage bag, 2 alcohol pads, tape, securing straps if you're using a leg bag, gloves, and a 60mm syringe. Wash your hands thoroughly with soap and water. If you have a stopcock, turn the stopcock lever to the drainage bag so it is pointing away from you and towards the bag. Disconnect the drainage bag from the tube. Put the used bag aside. Swab the end of the nephrostomy tube and the new bag tubing with an alcohol pad. Connect the new bag. Turn the stopcock lever back on to the drainage bag so it is pointing towards the clear flushing port. Secure the drainage bag. Secure a leg bag to the calf, thigh, or waist with tape or straps. Secure a night drainage bag to the side of the bed so it hangs below the level of the kidneys. Wash your hands. For daily cleaning, empty the urine out of the bag you have removed. Wash the bag with equal parts vinegar and water. Rinse with cool water and let it air dry. Wash your hands. It is important to note that drainage bags should be replaced at least every 7 days using the steps described. If the drainage bag becomes dirty, foul-smelling, or is punctured and/or leaking, it should be changed sooner. Dispose of the old empty bag in the trash. Flushing your nephrostomy tube. Mucus and fibrin may obstruct the flow of urine from the nephrostomy tube. Your doctor may want you to flush the tube with normal saline. A prescription for the saline will be given to you upon discharge. The radiologist who placed the tube will inform you if you need to flush the nephrostomy tube, how often to flush, and with how much fluid to flush with after your tube has been placed. Flushing is used to keep the nephrostomy tube clear of debris. To flush your tube, first gather your supplies: a 5 to 10 millimeter pre-filled saline syringe, an alcohol swab, and gloves. Thoroughly wash your hands with soap and water. Turn the stopcock lever off to the drainage bag so it is pointing away from you and pointing towards the bag. Swab the injection port on the stopcock with an alcohol pad. Attach the saline syringe onto the injection port. Use a new saline syringe every time. Slowly push in the saline. Do not pull back. If you cannot push in the saline, check the position of the stopcock and the tube for kinks. If you still cannot easily push in the saline, call your doctor. Remove the syringe and dispose of it in the garbage. Move the stopcock lever so it is pointing toward the flushing port. Check for urine in the tube and/or drainage bag. Wash your hands and apply gauze and secure the tubing connection. Important information. When you shower, cover the site with plastic wrap and secure the edge of the plastic wrap with tape. When done, remove the plastic wrap and blot the area dry. Do not submerge the site in a bathtub. Do not swim or sit in a hot tub. If the tube becomes disconnected, the connector should be cleaned with an alcohol swab or wipe before reconnecting to prevent infection. In case of tube dislodgement or accidental removal, notify your doctor immediately so the tube can be assessed and replaced. Large amounts of urine leakage around the tube or no drainage from the tube into the urine bag may mean there is a blockage. Notify your doctor immediately. Typically, your nephrostomy tube will be changed every 2 to 3 months to prevent infection. Your first replacement appointment can be set up prior to discharge.